iLive tweeted this morning's Senate hearing on COVID-19 with Anthony Fauci, MD, Director of the National Institute of Allergy and Infectious Diseases, Robert Redfield, MD, Director of the Centers for Disease Control and Prevention, CDC, Stephen Hahn, MD, Commissioner of the Food and Drug Administration, FDA, and Brett Goer, MD, Assistant Secretary for Health who's leading the U.S. coronavirus testing efforts. Below are 8 key points from the experts about the nation's response to the virus and what the future might look like as states inch toward reopening. 1. The National Institutes of Health, NIH, is pursuing several treatment options, including antivirals, convalescent plasma, monoclonal antibodies, and immune-based drugs. More than a dozen vaccines are also in development. The furthest along is in a Phase 1 clinical trial, with the possibility for entering Phase 2/3 this summer. The NIH will know if the vaccine is successful by winter. 2. We don't know yet if a vaccine will be successful, but Fauci is cautiously optimistic. The fact that most people generate antibodies and spontaneously clear the virus means from a conceptual standpoint that we can stimulate the body with a vaccine to get a similar response. 3. There are also concerns about scaling up manufacturing. Fauci says they're already making production bets and investing $100 million into the production of several different vaccine options, even before they know which one works. This ensures that when we do get an effective and safe vaccine, there will be doses already available. 4. We don't necessarily need an effective treatment and vaccine to open up the country. What we do need are surveillance efforts to provide testing, isolation, and contact tracing. 5. Redfield says the CDC is working with states to get contact tracing up and running and to cater to individual states' needs. Government service agencies like AmeriCorps could get involved to help. 6. Fauci says if we don't have these steps in place before we reopen, we can expect a deadly resurgence of the virus, which will also set us back economically. When you roll back restrictions, you will have an uptick in cases, so you must be ready to respond. 7. The United States is currently seeing 25,000 new cases and 2,000 new deaths per day. Fauci says these numbers are finally starting to drop, and he expects they will continue to decline over the summer, but the risk for a resurgence in the fall is real. Redfield says we need to prepare testing, tracing, and hospital surge capacity now. 8. Goer says the United States has conducted more than 9 million tests, more than any other country, and he plans to have capacity for 40 to 50 million tests per month available by September. But widely available testing doesn't nullify the need for sanitation, distancing, and masks.